Good morning. I want to say good morning to all the members, and thank you, Mark, and your leadership for having us on this morning. My name is Pete Blasi. I'm the CEO of my senior health plan, and I'm here with Duke Jarboe.
Hello.
He's our marketing coordinator, very essential to my senior health plan. And we're here to explain a little bit about my senior health plan and how we have worked with RESDC for the past 6 or so years. And we've been a proud sponsor since 2014 or so, but it's just been a great experience. If you have questions, just keep them at a general nature. Anything specific, you could always book an appointment with one of our licensed representatives, and they'll get deep into your situation. So without further ado, we'll go to our next slide.
Okay, I'm going to stop sharing because it froze up on me again and try to do this. Just bear with us, folks. It worked last time when I restarted it. So technology is our friend, everyone. Okay, now I'm going to share it.
So just a little high level clarification of what we do. If you don't already know, we work with a Medicare eligible population. Those that are 65 and over generally, or those that are disabled and receive Medicare early. So the Medicare population, and we, walk through those Medicare eligible people and help them find a plan that's most appropriate for them. And I'll give you a little bit of background about us. We're founded in 2003, and the idea is, where our place is in the market is I've seen there's a need for full transparency in senior health insurance. A lot of times, seniors go to a carrier and they're kind of sold on a particular plan, but there's many plans out there, and the most appropriate plan for the Medicare eligible member maybe not that particular company, or maybe not that company every year. So a place to compare all the plans and someone working for you on your side for your best interest and looking for the most appropriate plan for you. And that's our position. We've seen a lot of members on plans that are maybe not the most cost effective. Maybe they don't have all the bells and whistles that you're looking for. And we present the most appropriate plan for those Medicare eligible people. And we feel good about that. And that's our position in the market. So founded in 2003, our corporate office is here in San Diego, California. We've been a member, affiliate since 2014. We're licensed nationwide, which is really important to note, because people move out of San Diego and they think, well, wow, I'm lost wherever I land in Wichita, or Tennessee, or wherever we can help, because we represent most all plans nationwide. So we have thousands of members that we assist, and we want to make sure that they're satisfied, and we have a whole staff and apparatus that makes sure that if there's a question, they can we can answer the question. So, and we've refined it over the years, and I'd like to say that they're highly satisfied clients. And year over year, plans change, seniors' needs change, and we're here to satisfy them. So, and reevaluate those plans when needed. So, here's a little bit about my senior health plan. Yeah.
Can't hear it.
You not hearing that?
No.
Let me see what I can do here. Yeah. Yeah, that just froze up the screen. Hold on, see if I can get some technical assistance here. I'm going to stop it and start it again. Just give me a second. Try sharing that again. How about now?
No.
Yeah, the audio is not coming in for our side.
Yeah, I have all the audio. Just give me 1 second here. Let me try to see if I can get some more audio here. I'm going to check the audio settings and try to turn it up all the way. So I have all the audio test up all the way. Try that again. Thanks for bearing with us, folks. All right, we're gonna try this one more time here. Let me go back to the top here. Pete, give me a thumbs up or down as soon as I start this, all right?
Yes, sir.
Yeah, I'm not sure why we can't get the audio. We tried testing it in advance and we had some audio issues as well, but I have all my speakers up and I've started it and stopped it a couple times. Hold on, let's see if I can get some more support here. Email, it might be best, Pete, to share a link that we can send out to the members of the video. So it just seems like the audio is not working for whatever reason.
No problem. No problem.
I'm going to start it and stop it so we can make sure we can get the other slides in.
No problem.
Sorry about that, folks. It's just not.
We're going to get to the exciting thing anyway, to talk about what we do and really how we help the members.
Great. Let me just bring it up here and we'll start it again.
All right. So what we do, and this is the exciting part. So, you know, what does Medicare cover? What is not covered? Which plan is right for you? You know, we go through the enrollment process, and we have a simplified application process. Lots of digital enrollment ways to enroll or change your plan, reevaluate your plan, and we still do mail. We send out mail as well. But, you know, talking about these plans that are available, especially, you know, in San Diego, and now it's really nationwide. I mean, there's plans that, you know, cover chiropractic care. There's plans that cover dental. There's plans that have gym memberships, and there's plans that even have, wow, what's the thing that this year? IT services to help you navigate your iPhone or set up your internet. So there's plans that, you know, they've integrated so many different benefits into this plan, you know, looking for your business and to provide more benefits to attract you. So these are under the Medicare Advantage profile. So, there's Medicare Advantage, there's Medicare Supplement, and the advisors will go through the difference between the two of them and seeing which one is right for you. So again, the advisors go over what's covered, what's not covered, where you are right now. I know that the county has their plans, and we evaluate those plans in comparison to those on the individual market. So we go through the whole, enrollment process, and then we have a whole post-enrollment support team. If you have questions regarding these plans, or sometimes, you think it's a bill or a billing issue, you can always bring it to our attention, and we'll help you navigate through it. A lot of times at the bottom of the bill, it says it's not a bill, but we want to make you feel that that you're well informed. So we're always here for support. Slide.
Gonna have to start and stop it again. Apologize. It just freezes up for some reason.
Okay.
It's not our friend at this point, but I'm going to start it again and see if we can get it to forward again. Give me a second here, folks.
Yeah, and then talking about some of these additional benefits, some of the benefits are post-op services, in-home care, things like food is another one. Some even will supply food, and non-emergency transportation to and from your physician's office. So these are all things to kind of think about when evaluating your plan. And this is some of the stuff that our advisors will, go through. We've often been compared to high cap, and a high cap is a unique service, and it's a good service. They have multiple plans as well, and they provide a comparison to a particular extent. So this high cap sponsor, this is a sponsor, RESDC and things like this. Yeah, is it free and unbiased? I believe so. Can they provide a drug plan list? From the different carriers, I think they could, and they do, and they explain original Medicare and what the benefits you get from that. Yes, but I think there's certain points that it's really important to identify as they don't do, and they specifically won't do because of they're not licensed, and it would create a liability for high cap. So compare their plan and your group program, so they don't get into that. Physician coordination, like is your physician on the plan, or all of them on the plan? And if you're going through some type of therapy, they don't get that in depth into the plan. There's certain things called SEP knowledge. What does that mean? Special election periods. So, for example, those that are on the group program with the county, generally you'd be subject to AEP, or the Medicare enrollment cycle, where in AEP through October 15th through December 7th, you could change plans. But if you're on a group program, you get a special SEP, a special election. You could actually move any time of the year, because what you have is credible coverage through the county. So, and there's other types of SEP elections that you may be available to you, such as moving out of the county or moving out of the state, which is a little bit different, and those have its own separate types of rules. So, all our reps on average have been with us for, a decade. So they have in-depth SAP knowledge, and we go through in-depth training continuously every year. So on SAP knowledge and all these plans, we actually could give you an enrollment kit. High cap can't. They could give you a printout from Medicare, but we have the actual enrollment kits, and we could actually enroll you into the plan. So that we would be the agent of record, and then we could support you on that plan in post-enrollment support. So, which gives us access to certain elements of your plan, so we could answer questions on where you are with the plan. Again, we're a licensed agent, and we're licensed nationwide. So I think that's really important. So wherever you go, we can go with you and we can assist you. You don't have to go into another high cap office or something like this. So I think in recap, the high cap is a good service, but they only can move the ball, so far down the field, where we could take it all the way to the end zone.
Mm-hmm.
Would you say that's consistent, Duke?
Yes, definitely.
Okay. So, hopefully that fills in some of the gaps. Next slide, please. So a little bit of what we've done with the county and our relationship, to this point. And I think this slide deck is a little old, so we've helped more people, I think, than this. But it gives you an example. So we've had an overwhelming positive response from RESDC members in our service. And, that makes us feel really good. And we share this with Mark and his team, and how are things going and progressing, and the feedback that he gets, he shares with us as well. So at the making of this deck, we helped 175 retirees, and we helped them save more than $300,000 in premiums. So what does that break down? So when you look at that, it's $4,620 annual savings per retiree, because they were able to identify another plan. We were able to identify another plan that fits their needs, that's the most appropriate plan for their life. And we don't want to pull off anybody from this retiree program that that it's not appropriate then to pull off. We always want to make sure they're going into a better position with their health insurance. So in doing so, it saved the retirees $4,620 annually, and $300,000 if you aggregate all these retirees, also 175 of them. So I think it's important to note that we did not convert everybody that we spoke with, and there was 150 members we did enroll. We analyzed their plans and options, and we advised them to stay on their plan for now. And if they have additional questions, if something changes within their life, we're happy to go through the evaluation process again. But it's whatever's most appropriate for the member, or Medicare eligible senior in this case. And that's our position. So how we help you save retirement benefits versus the individual market. So, the county's negotiated rate for premiums could be inflated, it could be the not most competitive. There's more competitive pricing that may be available in the market with the same physician, with the same, very similar plan, either the same benefits, but it may cost less. And, you may be taking back what you could get on the market. And that's our position, to show you all the different plans that are available to you, so we could come up with an unbiased comparison as we represent the major plans, and we compare those benefits side by side for you.
And we also, all the local regional carriers that might not be available through the group plan, new and upcoming ones that have competitive rates and new benefits kind of might be more in line with what you're doing.
Yeah, there's even some plans that have recently come out that are more holistic care, things like acupuncture, types of alternative types of medicine. So, these are new plans that are kind of focused in that way. They have alternative medicine, vitamins and things like this that are part of the plan, and they see that there's a need in the market, and we have those plans as well. So the way forward, you could call us, toll free, and we have a toll free number here. We have our website, and we also, you could book an appointment from our website, myseniorhealthplan.com. You'll get a notification on your email and a reminder, and we will walk through that plan, have your prescriptions ready, have your preferred physicians ready, and then we'll take you through the process. And we have a number of ways to enroll these days. It's really evolved. We could mail out a kit to you. We can send you an enrollment link. Depending on the carrier, there's telephonic enrollment. We could email you a PDF and such. So we've made it really easy for you to get the information and go through the evaluation process step by step. So making sure you understand these programs inside and out before you enroll. So I think that's the deck.
Mm-hmm.
If there's any questions, I'd love to field those now. Again, just keep it broad and very non-specific to your private information. If you want to book an appointment, you're happy to do so on our website, and we're happy to help. And we're very, very appreciative of working with RESDC and assisting RESDC members and giving value to them through our platform.
Thank you very much, Pete. I haven't received any questions thus far, but I want to provide some flexibility on this and say, if anybody has a question, I have a raised hand.
Okay.
Give me a second here.
Okay.
Go ahead, Kim.
Thank you. I may have missed it. Is there a fee for your service?
There's no fee for our service. That's a great question. Our position, and the plans are the same if you went directly to any of these plans. It's just that, these plans will not say that they're, every plan's going to say that they're the best for you, and they're going to try to sell you their plan. Our position is this may be the most appropriate plan for this year, but plans change as well from year to year.
Mm-hmm.
So they're not going to call you back up the following year and say, oh, Mrs. Jones, we're not the most competitive anymore. You should be on the other plan because we've increased our premium and lowered our benefits. So our position is that we send a letter out, a hard letter and an email out to any of our clients that there's been a significant change in their plan, for them to reach out to us, and we want to reevaluate their plan because there's been a significant change. So every year we do an annual enrollment period letter to our clients, explaining that we're here for them to reevaluate their plan. Those that have significant changes, we identify them and send them a letter that explains that there's been a change in your plan. It may be beneficial to reevaluate your plan this year, so that we have a special team that just works with our existing clients and reevaluating their plans, because plans change. prescriptions change, health changes, and we're here to help.
Okay, thank you.
Okay.
Anybody else have a question? You can unmute yourself and ask. We don't have a huge amount of folks, so we can, like I said, provide some flexibility if someone else has a question they'd like to ask of Pete or Duke.
Yes, I have a question. Can you hear me?
Yes.
This is Drusilla. I'm with Kaiser and have been with Kaiser for a long time, and I'm very satisfied. However, I am relocating to Madison, Wisconsin, and there is no Kaiser there. So I'm open for a comparable service that I can enroll there. As of the last of this month will be my last day in San Diego.
Yep. So absolutely. So that would be, you could book an appointment on our site, or you could send an email to us if you like that as well, or you could just give us a call, and then we will help you evaluate the plans in Madison, and then present those to you. So when you arrive, you already have the ball, going, and you'll be enrolled, for the first of the following month would be your effective date. So in this case, it would be 12/1.
And is the correct number to call you 1-800-201-5183? Yes. Okay. Thank
Yes. Yes. And I wish you a safe travel to Madison, Wisconsin.
Enjoy the cheese curds.
Yeah,
Thank
because
you.
my wife is from there, so.
Oh, okay. Well, my daughter is with the university there.
Oh,
and,
wonderful.
So I'm relocating so that I can be closer to family.
Wonderful. Good, good. Well, happy holidays, and that's wonderful that you're able to do that. So.
Any other questions, or are we all good?
I have
And
a question.
I'm sorry.
Okay, go
Also,
ahead.
the dental plan.
Yeah.
I need to know also if Delta Dental is there, or do I need to choose another dentist? I mean, another dental plan.
Great question. We do represent dental plans. Many of the plans have a integrated dental program that's available, but the representative will explain, all that's available to you.
Okay, thank you very much.
Absolutely.
Can you hear me?
Yes.
Oh, okay. I just need a question. What about international reach? You said you have nationwide reach. What about for those retirees that plan to spend considerable time overseas?
Yeah.
Short of getting travel insurance, does your plan provide anything for overseas retirees?
So, couple things to know about international plans. So one, we do offer a separate long-term international plan for expats, so we do have that. We do also, it's also to know Medicare Advantage plans do cover outside of the country as well, depending on how long you plan to be outside the country. So, and then, so they do have, depending on the plan, some unique international plans. Now, Medicare supplements generally cover up to 50,000 outside of the country. So it's kind of limited on the Medicare supplement plans. Again, the representative will, bring that to your attention, so you can make a proper decision on which way to go with your health insurance that's international outside of the U.S.
Okay.
Yeah.
I have another question for you, Pete, that came in from the group. Why would someone choose a premium policy when there are so many zero premium policies available?
Well, that's a question. That's a great question. There's a lot of different reasons why. Even though premium, there may be a zero on the premium, but there's still co-payments involved. So, and depending on what you have going on, you may want a lower co-payment for your prescription drugs. So, they'll go through the math with, with the Medicare eligible member and see if it makes sense to have a small premium on their, get the enhanced plan, for example, over the zero plan, depending on what's going on in their life. Sometimes those plans that have a small premium, they have some bells and whistles to it. They may find that there's a benefit to, right, Duke?
Mhm.
Like things like gym memberships, integrated dental programs, like a robust dental program, lower premiums on their prescriptions, lower premiums on procedures if especially if there's a procedure coming up, So inpatient hospitalization, things like that. And sometimes, seniors think there's a value to that and they're willing to pay for a premium. In addition, there's certain physician sets even that they're like, well, we'll be in the plan, but we need, we need a co-payment or things like this, or we need a premium for this, this physician panel. So health insurance organizations will carve out plans just for a certain physician panel as well. That's in a county. So yeah.
And that's one of the benefits of My Senior Health Plan's, agents. They have so much experience crunching these numbers. You're not going to really get that outside of us. We really take the time to make those comparisons for you. Whereas like the carrier or a high cap, they're just not going to have that kind of interest level.
Right. Great point, Duke. So yeah, sometimes it could make sense, and sometimes it doesn't. So, but we present it, in such a way that all options are presented. Yeah, great question.
Anyone else for the record before we move on to our ending the meeting and thanking everyone for coming? Anybody else? If you're muted, you can unmute yourself. Well, I highly recommend, if you haven't had the chance to visit My Senior Health Plan's website, that you do that. It's just www.myseniorhealthplan.com. Pete had mentioned that you can actually, register for an appointment and learn a lot more information about their services.